Hello everyone, good evening. I'm Shreya Dhondial. It's good to see you. In case you haven't noticed, people all around us are getting infected with COVID once again. It's happening all over, in our colonies, in our offices, in our friends circle as well, family as well. 66 people on board a cruise ship have tested positive. People without a travel history like John Abraham and Prem Chopra have tested positive as well. If you want today's numbers, then 34,000 people have tested positive for COVID today itself. Of course, that is not a patch on the 4 lakh daily cases that were being reported during the second wave, but we'll soon be there given the trend that is coming to us from across the world. So has the third wave started? Do we really only have 1,700 Omicron cases in India? Is Omicron already the dominant strain in the country? And what is the worst case scenario that we are looking at? I have 10 questions for 3 doctors who are joining me this evening. Dr. Arvind Kumar is one of India's best known chest surgeons. He is with us this evening answering my questions. So is Dr. Harsh Mahajan, who is one of India's best known radiologists, and Dr. Dhanya Dharampalan is a specialist in pediatric infectious diseases. So 10 questions for these 3 top doctors in our doctor's debrief this evening. But before I put my 10 questions to the 3 doctors, take a quick look at why underplaying the Omicron threat by calling it mild will do us no good. A new year, a new nightmare. As 2,000 plus revelers partied on board the Cordelia cruise headed to Goa from Mumbai, little did they know that a stowaway had also come on board. Amidst the ill-timed celebration, the storm struck. First, a crew member tested positive. Now, 65 passengers on board have tested positive as well. India too is feeling the shocks of the incoming tidal wave. The centre has said that there is clear indication that Omicron is replacing Delta as the dominant variant in the country, much like in the US and Europe. The surge in cases has been dramatic. Take a look at this. In early December, India's cases were at a 19-month low, some 6,000 cases daily. But the story has changed rapidly in the last 7 days. Today, 34,000 cases have been reported. Delhi and Mumbai once again are the big worry spots. Mumbai has reported 8,000 cases. Delhi, 4,099 cases. That is the highest single-day spike since May last year. Delhi's Health Minister Satyendra Jain says 84% cases found positive in the last 48 hours are of the Omicron variant.
सतर्क रहने की जरूरत है। 2 दिन का जो लास्ट 2 डेज का बता सकता हूँ, उनमें 84% जो पेशेंट थे वो ओमिक्रॉन के थे।
So far, data from across the world suggests that the impact of the Omicron is mild. But on the downside, it spreads at lightning speed and cuts through vaccine immunity, which means more people will fall sick in a short period of time, sending the healthcare system on the brink of collapse.
This virus will continue to evolve and threaten our health system if we don't improve the collective response. Right now, Delta and Omicron are twin threats that are driving up cases to record numbers.
In India, the community transmission of the Omicron variant is underway. Delhi is an indicator where 50% cases had no travel history. In Mumbai, actor John Abraham, producer Ekta Kapoor, and actor Prem Chopra, who's 86, have tested positive. Again, none of them had any recent travel history. Devastating images of the second wave still haunt. A third wave that will peak in February has started, and yet lessons haven't been learnt. Not by citizens, and by the looks of it, not by state governments either. Collectively, all states have used only 17% of COVID funds that have been given by the centre. With Natasha Menden in New Delhi, I'm Shreya Dhondial. Let me introduce my 3 guests this evening. They are part of Debrief's doctor panel today. Dr. Arvind Kumar is the chairperson, Institute of Chest Surgery at the Medanta Hospital. He is joining us today. Dr. Harsh Mahajan is the founder and chief radiologist of Mahajan Imaging, one of India's best-known radiologists. And Dr. Dhanya Dharampalan is a consultant at the Pediatric Infectious Disease at the Apollo Hospital in Navi Mumbai. Dr. Mahajan, I'm going to start with you first, and I want you to be honest. We are officially being told that there are only 1,700 Omicron cases in this country. Is that really so? And what are the real numbers we are looking at?
Thank you very much for having me on the show. And this is a very important question that you asked. Certainly, the number is much, much more, because as we've seen, you are able to define a case as being Omicron only once the genome sequencing of the virus has been done. And that takes time. It takes 7 to 8 days to get a report back. And what we've heard from Delhi today is that 84% of all the genome sequencing that was done in the last 2 days turned out to be Omicron. So if we look at the burgeoning numbers that we've seen in the last 1 week and crossing 30,000 a day, even if we were to take 50% of that, the total number of Omicron cases would be very, very high.
When we say very high, Dr. Mahajan, how high? Are we, if we say 1,700 cases right now, is the real figure what? Is it 20,000, 30,000? What is that number we are looking at?
It would be somewhere in that vicinity, if not more. And we do know that there's a lot of asymptomatic disease that is prevalent with Omicron. Nearly 60 to 70% of patients may be asymptomatic. And what they are doing actually in South Africa, from the numbers that they were able to actually diagnose, they were multiplying it by at least 10, a factor of 10. So the numbers would be very, very high. We are seeing community transmission that's on. And so the numbers are very high, in the high thousands.
Okay, in the high thousands. So you're saying 18 to 20,000. Then the next question is, given the amount of testing you do, I think you're the best person who can answer this question for us. Given that, is Omicron already the dominant strain in this country? Right now, there is no official word on it. But my question to you, Dr. Mahajan, is this: is Omicron already the dominant strain in the country?
Well, we don't have any evidence of that. But if we were to see what happened in South Africa or in the US, UK, France, where we find that very quickly, actually in the US, from 1% of all new cases on December 1, on December 23rd, it was upward of 80%. So there is no reason why it should be different in our country. They also had Delta, which was overshadowed by Omicron. And so predominantly, I would think that even in our country, the factor would be changing. And as the Delhi figures show, that of the genome sequencing done in the last 2 days, 84% were Omicron. So from that, it would appear that Omicron is rapidly replacing Delta in India as well.
Okay, Dr. Mahajan, we'll fix your line. There's a little problem with your audio, but you're telling us that Omicron probably is already the dominant strain in this country. If you look at the figures that are coming to us from Delhi, the national capital, where all positive samples are actually being sent for genome sequencing. It's not happening anywhere else in the country, but it's happening in Delhi. And in the last 48 hours, 84% Omicron cases that have been reported, 84 positive cases that have been reported have been Omicron. Dr. Arvind Kumar, you're joining us then. Has the third wave already started?
Could you please repeat the question again?
Dr. Arvind Kumar, I'm asking, has the third wave already started?
Yes, sir. If you look at the pattern in the last 3 to 4 weeks, it's clear that the third wave as well as the community transmission is already there. And I'll give you the reason. When we started this towards the end of November, we are only noticing it initially in people who had a travel history. But if you look at the pattern of cases we've seen today and the way it is being reported from every nook and corner of the country, it's clear, and the speed with which the cases number are increasing. You look at the Delhi's positivity rate. Today it's reported to be above 5%. And whenever the positivity rate goes above 5%, it's a danger signal. So from 0.01% that it was a few weeks back, we have galloped to 4 and 5%. And the same is being noticed in different parts of the country. So
Okay.
two things are very clear, that number one, the community transmission is very much there.
Okay.
And number two, it is already taking shape of a third wave.
Is it going to be mild, and is that mild still going to be severe when it comes to our healthcare system, when it comes to the impact on our healthcare system?
So we've had very divergent views. So on one hand, WHO has taken a very precautionary step by warning us that it's not a wave, it's going to be tsunami. Whereas we have the doctors coming on television and saying it's going to be a mild breeze or it will just be a kind of an easy thing to do. I think the reality is probably going to be somewhere in between. The number of cases are increasing. Even in Delta wave, we saw that in the beginning, the cases were not as severe as during April and May. So therefore, I think it's but the major difference between last time and this time is that we have a much larger percentage of population which is vaccinated this time.
Sure.
And I think that is going to be us saying this. It will also depend on how we behave. If we continue to behave with COVID inappropriate behavior and say, no, it's a mild problem, we are not going to be bothered about it, then I think we are in for a serious time.
Okay.
Because even if it's a mild disease, numbers so in crores, you will have your health system being overwhelmed.
Okay.
So I think it's time for cautionary approach, and time for that cautionary approach is right now.
Okay, and the time is right now, you're saying. The Sutra model is predicting that the peak will happen on February 3rd, the national peak will happen on February 3rd, but they are saying the numbers that will be reported are between 1 lakh to 1.5 lakh daily. But could this number be much, much more, given what we are seeing in Europe, given what we are seeing in the United States of America, where one city, New York, yesterday had reported 85,000 cases, a single city. Dr. Dharampalan, I'm coming to you now. Dr. Kumar has spoken about the vaccinated population and how vaccination to some degree will probably keep the disease mild, etc. What about kids? Will we see more hospitalization of children, especially below the age of 15?
Yeah, so thank you, Shreya. There has been increase in the number of children visiting the outpatient department since past few days with respiratory complaints, but they have been fortunately mild so far of fever, cough, cold. But at the same time, we are on an alert, especially children who have comorbid conditions of chronic conditions, heart problems, whether there could be more severity in those children. So far, we haven't seen, but we cannot be totally confident at this point. Also, you are aware of this very rare complication of multisystem inflammatory syndrome that is usually seen in children that occurs 4 to 5 weeks after COVID infection. And that is not related to severity of the COVID. So we need to be cautious and we are keeping our fingers crossed that though it is a rare complication, that numbers also don't go up in the upcoming weeks.
Okay. Dr. Dharampalan, I'm going to ask you a question which many parents would have already asked you. At least in North India, this is the winter season. This is the season for cold and cough. Many people are asking, how do we even know the difference between cold and Omicron? Because it seems the symptoms are very similar.
True, absolutely right. The symptoms are similar. There is no way to find out unless tested. And especially with the community transmission, we cannot even go by history of contact with foreign travelers anymore. So, but Definitely, we can differentiate from other wheezing children who wheeze during winters, because you have family history of similar complaints in the family most of the times in a viral infection. So that is the only way by history. But unless tested, no one would be able to say 100% that this is not COVID or this is COVID.
Just my last question related to kids. Are the symptoms between kids and adults different from Omicron? And I'm asking you this question because Omicron is already on its way to being the dominant variant in India, if not already.
You're saying, sorry, can you repeat your question?
My question is
similar to Delta?
Yeah, no, that's not my question. My question is, are the symptoms of Omicron the same in adults as they are in children, or do children exhibit different symptoms?
So far, we are not seeing any difference. It's the same mild symptoms of throat pain, fever, cough, cold. So far, we have not seen anything different happening in children.
Okay. Dr. Arvind Kumar, if Omicron is so contagious and if it is spreading at such a rapid speed, and we know it is, it's a champion spreader in that sense, will masks really help?
Today, one of the most effective preventive measures that we have is mask. So spreading fast is a characteristic of the spike protein of the virus, but this virus is the same virus. So as far as the size of the particle is concerned, it's not changed. It's changed in terms of its amino acid sequence and cause mutation. So effectiveness of the mask remains the same for every mutant strain. And therefore, I say that the value of mask, particularly the N95, is far more today in preventing the spread of this highly infectious disease. We should vow not to move out of the house without a properly fitting N95 mask. I'm wearing it in the car also. I just removed it so that my voice is audible. And we should also avoid another thing, and that is people accumulating in closed spaces. We have seen time and again, and there are reports from across the world, that the highest incidence of transmission is when people assemble in a closed space, like for a party or etc. etc. That is when the highest chance of infection is there. So if we can wear mask all the time, if we can avoid people assembling in closed spaces, if we maintain distance, if we stay indoors unless unavoidable, and each one of us gets vaccinated, if we do these 4 measures, I'm sure we will be able to reduce the impact of this virus.
Dr. Mahajan, there is already talk of this Delta and Omicron variant fusing together to make a more dangerous mutant. Is that a real fear? And what is the worst case scenario?
No, I don't think anything like that is going to happen. Each one mutates on its own. The only fear really is that with the number of infected people increasing so much, the viral replication actually goes on to millions and millions of cases, and with this, the chance of it further mutating. Right now, the initial information that we have is that this is a milder variety of the virus. The infection is milder, though of course much more contagious. But as more and more people get infected, and especially in those who are unvaccinated, the chance of its further mutation is very, very high. It will keep mutating as a property that it has, and it mutating into something worse cannot be ruled out. That only time will tell. And that's why we have to reduce the number of people who are infected. And I echo exactly what Dr. Arvind has said, that we need to wear masks, we need to follow COVID appropriate behavior. Even those who have been vaccinated and those who will be getting the booster in the coming weeks, they all need to follow COVID appropriate behavior.
You know, it's a bit
also,
of a tragedy.
What we were seeing today on your channel was when you were showing children children getting vaccinated, all the children were wearing the mask very well.
Correct.
But some of the parents accompanying them,
Dr.
even
Mahajan,
some of
you
the
know,
healthcare workers
Sure.
were not wearing the mask properly.
You know what? Well, you know, the tragedy is that we've known this for 2 years, that COVID is still not over. You need to wear a mask. You don't need to go out where there are huge crowds. And yet it seems that we simply don't need to learn our lessons well enough. Dr. Arvind Kumar, my last question to you is Molnupiravir the magic pill for everyone?
Sorry, could you please repeat the question?
I'm asking you if Molnupiravir is the magic pill for every age group as far as COVID-19 and Omicron is concerned, sir?
No. I don't think this drug is a magic pill at all. I think it's a too much hyped up medicine. I would put my entire money on the COVID appropriate behavior and covering 100% of the population with 2 doses initially, and those who have received it more than 6 months back, I would give them all a booster or a precautionary, whatever name you want to use. I would put my money on this and not on that so-called magic medicine. No.
Okay, we'll leave it there for the moment. I thank you for your frankness and honesty. Dr. Arvind Kumar, Dr. Harsh Mahajan and Dr. Dhanya Dharampalan, thank you very much. One of these days on Debrief, we'll be opening our phone lines for our viewers. So in case they have questions for you, we'll invite you back on the show. Thank you very much for the moment. Meanwhile, it has been a milestone day today as far as India's vaccination program is concerned. 30 lakh students have been vaccinated today as India has opened up inoculations to teens. We have a full report coming up from across the country. Do stay with us. Welcome back. It was a milestone day in India's fight against COVID-19. Students between the ages of 15 to 18 have started getting vaccinated. 30 lakh were vaccinated today, and parents of young kids are already asking that very important question: when will our kids be vaccinated?
Nearly a year after India started the world's biggest COVID vaccine drive, we've entered the next phase: inoculating children.
I was the first one to get vaccinated. अब तक कोई pain नहीं है, कोई side effect नहीं है. It's normal.
It doesn't get safer than this, so I feel it's a very good initiative by the government.
वैक्सीन लग रहा तो बहुत अच्छी बात है.
The age group 15 to 18 years. The target 10 crore of India's population. The vaccine only Bharat Biotech's Covaxin for the time being.
यही मैसेज देना चाहूँगा कि कोई डरने वाली बात नहीं है, कुछ ऐसा नहीं है, कोई साइड इफेक्ट भी नहीं है और बिल्कुल सेफ है.
बड़ों को लग रहा था तो हमें भी लग रहा था कि हमें भी लगे, हम भी सुरक्षित हो जाए.
कोविड प्रोटोकॉल्स का अभी भी फॉलो तो करना पड़ेगा, लेकिन अंदर ही एक इम्यूनिटी बनने वाली है.
Since schools and colleges reopened earlier this year, a substantial section of kids and teens have contracted the virus. Several outbreaks have been reported in residential schools and college hostels. So while many may argue that the decision to vaccinate kids is a late one, it's necessary nonetheless.
15 to 18 जो एज ग्रुप है उन्हें अब बहुत बाहर निकलने की ज़रूरत थी और अब एक सेंस ऑफ सिक्योरिटी भी आ जाएगी तो बहुत अच्छी बात है.
While no decision has been taken on vaccinating kids younger than 15 in India, many other countries are inoculating children as young as 5 years, and with good reason. As the Omicron variant spreads like wildfire, what's abundantly clear is that kids are not immune. In the US, for example, pediatric hospitalizations have increased 58% towards the end of December, whereas hospitalizations for all age groups during the same period was about 19%. Anyone above the age of 5 is eligible for the COVID vaccine in the US, but less than 25% of the country's under 18 population is vaccinated.
The only difficulty is that when you have so many cases, even if the rate of hospitalization is lower with Omicron than it is with Delta, there's still the danger that you're going to have a surging of hospitalizations that might stress the healthcare system.
While new cases slowed down in South Africa, it wasn't long back that there was a sharp rise in hospitalization of kids.
The first group that come in would be the younger people, all right? But it's not to say it's only targeting the younger people. You know, it would be the children in schools. You know, it would be the younger people who go out and party and all of that. And yes, and then your older patient starts to come in.
But in the UK, which is witnessing an Omicron tidal wave of sorts, children are bearing the brunt. December witnessed a 143% increase in hospitalization of kids under the age of 5. According to a study conducted by Imperial College London, COVID infection rates among children aged 5 to 11 are 3 times those in the general population. So the writing is on the wall. If we don't inoculate our youngest population, we can't stop the virus from mutating and maybe even coming back stronger. With Rajiv Kumar, Anisya Kumar for CNN News 18.
26% of our population is under the age of 15. They will need to be vaccinated as well, sooner rather than later. With that, it's a wrap from me. We are tracking the Omicron surge through this week here on Debrief. So do keep tuning in. Thanks for watching and good night. And have a very happy new year.